Uh, Here we are, we're going to go over cranial nerve testing, just a couple of the cranial nerves. We won't go over every one of them. Let's go over cranial nerve 2, okay? So this is the mini eye chart. I'm actually going to give you this eye chart right here. Mm-hmm. You're going to cover one of your, let's see, you're going to cover one eye without pressing the eyeball, so just cover one of your eyes, hold it about arm's length out, and then see if you can read the bottom of that list.
FDPLTCEO.
Okay, and then we'll cover the other eye.
FDPLTCEO.
All right, so both of them are fine. That would be adequate. All right, so next we're going to do a peripheral vision test. It's still the cranial nerve 2. So you're going to look straight ahead. I'm going to stand behind you, and you're going to tell me when you can see my right hand, okay?
Right now.
All right. You're going to see about my left hand?
Right now.
All right. So they're both equal, about the same distance from each other when you were able to see it. Cranial nerve 3, 4, and 6. This is the broad H pattern. I want to just draw an H, and I want to test this by just looking at your eyes. So you're just going to follow my finger. So we'll start in the middle. No deficits there. Next is accommodation. So I want to hold my finger about 12 inches away from your face, and then we'll go into about 6, and that's just to see the focus, okay? So here. Nice. And then next is pupillary and consensual reflex. What I'll do, since it's already dark in here, do you have a phone on you?
No.
I don't either.
Let me go get it.
Okay.
I just have the desk here.
All right. We'll look at your pupils. So I'm going to look at one. You look straight at me. Your pupils are a bit big. All right. So both of them are reactive. And then cranial nerve 5, we'll use a cotton thing to a cotton ball to see if you have any corneal reflex.
This is cruel.
I'm not gonna touch your eye. We know that you have that reflex. But in this scenario, we would take a little cotton swab and poke their eye. These are dirty, so I'm not going to poke her eye. We will do this one. This one's the bite strength. It's a motor reflex. So what I'm going to do is take this sterile tongue depressor, and we'll tell her to say ah, and I'm going to stand to the side. So if she gags and spits something, she doesn't spit at me, okay? So she has a little bit of a gag reflex, which is good. This is how we kind of test patients that are intubated also if they have a cough or a gag reflex. Cranial nerve 7 is our facial motor. We'll just ask you to raise your eyebrows, smile, and squeeze and shut your eyes, and stick your tongue out at me. Let's see. I did that wrong. Cranial nerve 9 is your gag reflex. Cranial nerve 5 is your bite strength. We're testing to see if she has a good bite strength, which she does, so we won't go over that. But you would still do the tongue depressor in the mouth, and they would just bite down, and that is cranial nerve 5. Cranial nerve 11 is our last one, and it is our trapezius, and we're going to test her motor of that and her head control side to side. So usually we would have the doctor or the nurse stand behind the patient. This room is kind of small, so we're just going to do it right here in front. So I would put my hand on her shoulder, and she would try to raise her trapezius up, and then the other side. So both of them are equal, both of them are about the same. And then next, we would put our hand on their cheek, looking, and we would be behind them. So, we would just tell them to turn their cheek, and then tell them to turn the cheek the other way. and see if, give them a little resistance. If it's hard on them to turn their head, there may be something going on with their accessory muscle, which is cranial nerve 11. Thank you.